Hi, everyone. Dr. Lori Marbus here to talk on our third day regarding female hormones, specifically around estrogen, progesterone, testosterone, FSH, and LH, which we'll cover tomorrow, the next few days. Today is about testosterone. A few days ago, I did one on estrogen. Yesterday, I did one on progesterone. And today, we're going to talk about testosterone. It's not something you typically would think about when we speak about women's hormones. But welcome to the channel. By the way, if you're new here, please hit the subscribe button. I'm happy to have you on board, and hit the alert button so you'll know when I do my lives and when new videos come out. And if you're new to me, I'm Dr. Lori Marbus. I'm a board-certified family and lifestyle medicine physician. I'm licensed in all 50 states and also DC to see patients across the country. If you'd like to sign up for our email list where I send out newsletters every week, also about a lot of topics, and provide a really healthy whole food plant-based recipe, you can check us out at drmarbus.com. So let's dive right in and let's discuss testosterone. I'm going to pull up my notes here real quick. That would not be them. 1 second. Here we go. All right. First of all, just remember that testosterone is not made just by men. Women have it as well. So we're going to explore the physiology, and often it's overshadowed by the estrogen and the progesterone, but it does play kind of a very kind of crucial role. So first of all, testosterone is what we describe as an androgen, right? So it's a type of hormone, again, more associated with male traits, reproductive activity, but it's incredibly important for women too. In women, testosterone is made in smaller amounts by the ovaries and the adrenal glands. And this is kind of how it works. For number one, production and regulation, ovaries produce testosterone as part of the overall balance of sex hormones, right? It's actually secreted by the theca cells of the ovaries. And then the adrenal glands, these are little glands that sit on top of your kidneys. They produce a small quantity of testosterone, much smaller than what your ovaries are doing. And what is the actual function in women? Well, I would say there's probably 5. One is muscle mass, right? So testosterone helps build muscle mass and strength. Of course, we understand that. We hear that often with men. They take the muscle mass when they're wanting to bulk or gain. But also it's important for bone health, right? It also can help prevent osteoporosis. And libido, I would say, is the largest one for women that comes to mind when we think about women wanting to potentially utilize hormone replacement therapy or menopausal therapy, is because of a loss of libido. And so that sexual desire and arousal may have significant decline. It can also help with mood and energy. Many times when men are seeking help for lower testosterone, it's because they have low mood or a lot of fatigue. And I would say the same can be said for women. Also interesting, there's some emerging research that's showing that it might actually play a really important role in your cognitive health, in your brain health. So let's talk a little bit about what do testosterone levels do over time, right? So when women's testosterone levels typically peak in their mid to late 20s and then gradually decline with age. And by the time menopause arrives around age 51, you have about half of what they were at their peak. So that decline can lead to symptoms that many times will kind of overlap with the lack of estrogen or estrogen deficiency that occurs with perimenopause and menopause. So a good way to approach that was, one, if you are thinking about engaging or seeking treatment for your symptoms, utilizing estrogen and progesterone first before adding the testosterone. I would do those first because that may resolve all your symptoms, because of course it's still a medication. It can have side effects, and one less medication is always better. Next, let's talk about a few of those symptoms with that low testosterone that may happen during perimenopause, menopause. Like, makes sense. We talked a little bit about decreased libido. So you may see a decline in sexual desire or responsiveness, fatigue, persistent, just chronic fatigue despite adequate sleep, mood changes, including irritability, depression, or mood swings, muscle weakness, maybe you have loss of muscle strength and tone, and then maybe some difficulty with cognition, right? So concentration and memory. And so the research on testosterone therapy in women is interesting. So let's talk a little bit about the efficacy, right? So when you look at libido and sexual function, multiple studies have shown that testosterone therapy can significantly improve sexual desire, arousal, and satisfaction in women with what we describe as hypoactive sexual desire disorder, or HSDD. Mood and energy. Some studies suggest that you might see some improvements in mood and energy levels, though results can be mixed, and I think more research is probably going to be needed. What about the safety and risk, right? So side effects. Potential side effects include things like acne, hair growth, voice changes. I think that's on a very large amount. Typically, women who are going to be treated with HRT are going to have a much lower amount and shouldn't have those things. But one other thing that you want to be careful is if you are given an oral testosterone, which I don't even think they offer that here in the United States, but it can cause some liver issues. Long-term risk. There's limited long-term data, but concerns could include risk about cardiovascular health, breast cancer risk, and such. So I think obviously there needs to be some more research on this, and I'm going to talk to you about the guidelines and recommendations from two organizations right now. One is the North American Menopause Society, which is now just the Menopause Society. They've recently changed their name. They suggest that testosterone should be considered in women who have that hypoactive sexual disorder, right? So that would be the one indication that they would feel is important. But I would also make sure that you do, like I said before, the estrogen and progesterone first, because many times that will take care of all of the symptoms that you're having difficulty with, or at least the most difficult ones. And then you have the Endocrine Society, right? So these are doctors who deal with hormones on a regular basis. They continually recommend against testosterone therapy for all women and acknowledge its role, however, in sexual dysfunction. But again, they only say it might be relevant if all other therapies have failed. So getting back to it, testosterone is a vital hormone for women, albeit, it's a smaller player than the estrogen and the progesterone, but it could be helpful in a wide range of physical, mental, and emotional health aspects. So that would be my recommendation, is just speak to your doctor, one, about what your symptoms are in general. I've done other videos all about menopausal, perimenopausal symptoms. And the reason being, as I entered this about 9-10 months ago, I had a significant shift in how I felt. And so I've chosen to embrace hormone replacement therapy, and I feel much, much better. And so that's why I chose to take up the torch and share this information with us, because this conversation has been delayed for decades because of a study called the Women's Health Initiative back in 2002. And I think more and more research is certainly coming out, but this conversation needs to be discussed. Women in general have been excluded from research, and speaking specifically about women's health is so very important. And honestly, it's time, ladies. It's time that we said, hey, we're half the population, and we deserve to be treated with some more acknowledgement of what we're dealing with as we age, because every woman, if you live long enough, will enter menopause. It's just the way the ball rolls. It's not something you're going to be able to avoid. So let's talk about it, and please comment and share this video if you find it helpful. I try to read and respond to as many of those as I can, and I do appreciate you. Again, please subscribe, share the video, leave comments. It helps the channel grow and get more and more information out to those who might need it. So as always, I'm so grateful for you. I'm sending you joy, love, and peace and gratitude your way, and of course healing, because we all need more of that in this world. So have a great rest of your day, everyone, and we'll see you soon.